unfortunately, it has come to the last session of the day, but we've got a great panel to finish on. We'll never work the same again. If we had £1 for every time we heard someone say this, then we could all quit our jobs, I'm pretty sure. Returning to the sort of quote-unquote new normal is a hot topic and has been for a while. But behind all the jargon and the cliches, there's actually something quite exciting about not working how we worked before. You know, us as charities have made real incredible strides in digital progress during lockdown. We transformed everything from service delivery to fundraising and all those things in between. But return to normal really mean for all this progress? Well, leading our panel to discuss that very question is Matt Haworth, friend of Charity Digital and founder of Reason Digital. Welcome, Matt. How are you doing?
Hi, Chris. I'm good, thanks. How about yourself?
I am not bad, thank you. I'm not bad. Doing well at all. Did you watch a match last night?
I'm not a massive football fan, but I did have a background. So you couldn't help but kind of know what was going on because I live in the city centre. Just the noise around me told me everything I need.
I don't think whether football fans sort of getting embraced by it, aren't they? It's just adopting the whole nation. It's incredible. Anyways, I will hand over to you to introduce the panel and take us away.
That's great. Thanks. So yeah, fantastic panel for you. Some real absolute kind of experts by experience in this area. So I'm joined by Matt James from WellChild. Matt, do you want to pop your camera on for us and join us? I've also got Steph from MSI Reproductive Choices, Suzanne from Cruse Bereavement Care, from Diabetes UK, who should all be hopefully appearing on our screen. Fantastic. Great, everybody. So yeah, just to start off with, I'm sure some of you have been around and kind of networking, so some people will already know who you are, but maybe for the benefit of those that don't, it'd be great if we could just go around and introduce ourselves, the organisation that we're with, and I guess a little bit about what the organisation does, just to give a bit of context. So, Steph, would you like to take the mic first?
Yeah, sure. Thanks, Matt. Hi, everybody. I'm Steph. I'm the Associate Director of Data and Digital Transformation for a charity called MSI Reproductive Choices. Very long name. We're a global charity. We have 37 country programs where we work out of, and I focus primarily on the UK. We provide NHS-funded and self-funded abortion, vasectomy and contraceptive care through our network of 60+ local clinics all across England. So I'm really excited to speak to you later on today, a little bit about what we've done to transform.
Thanks, Steph. Do you want to mic next?
Thanks, Matt. Hi, everybody. My name is Matt James. I'm Director of Communications and Engagement at WellChild. We are a national charity for seriously ill children and their families. We primarily support children and families with serious and complex medical needs. Our primary mission is to ensure that they've got the very best chance to thrive at home wherever possible. We achieve that through a nationwide network of WellChild nurses who are working within the NHS up and down the country, supporting families, as well as home and garden transformation projects and family training and support services. So that's what we do. I'm looking forward to this discussion.
Thanks. Siad?
Thanks, Matt. I'm Siad. I'm Head of Digital at Diabetes UK, with the only national charity for people of all different types of diabetes.
Last but by no means.
Hello, I'm Suzanne. I'm the Digital Transformation Lead at Cruse Bereavement Care, and we're a national charity providing bereavement support to anyone who is grieving. And we do that through a network of 4,000 trained volunteers, and they usually work locally. And much of our service pre-pandemic was one-to-one in-person support. But we also do group support, and we have a helpline, we have a live chat facility, and we do a lot of information provision as well.
Great, thanks. So yeah, everybody, you can hear the cause and also the breadth of experience here on the panel today. So I just wanted to start off just by diving into something really real and really tangible, so that we've got something to kind of hang what we're discussing off onto. So yeah, the first thing I'd be really interested to hear from the panel is around a service that you've transformed, just about kind of what the service was and what the service now is after that digital transformation. So yeah, does anybody want to jump in on that?
Yeah, I can kick off. So I think we benefited from having like a strong digital offer anyway. We've got obviously website, forum, we've got a product called Learning Zone, which people with diabetes use to learn more about diabetes when they're diagnosed. I think particularly on the fundraising side, we had self-service events like Million Step Challenge, but then immediately we saw this kind of massive increase in challenge, people with diabetes facing really kind of confusing messaging around things like shielding. So the website and nuanced messaging, regional messaging became really important. But the first actual big change I think that we had to do was to help pivot our local groups to online. So these were people who were meeting kind of face to face, and obviously people with diabetes weren't going to be able to do that and still aren't. And so use of things like Facebook groups and Zoom. We've heard about soft phones helping the helpline kind of work from home. But the one I really wanted to talk about was, you know, a big part of our work is trying to help the health system get through this. And so up until the pandemic, there'd been a service which you could be referred to by your GPs if you were seen to be at risk of diabetes. And obviously that wasn't going to be possible because the GPs weren't open for that. And we'd already had a product called Know Your Risk, which allows you to answer a few questions and then you find your risk of diabetes. And so we worked with colleagues in the diabetes prevention program. They ran a big marketing campaign, still are, sending traffic to that. And then if you're at moderate or high risk, we've built a pathway in order that you can self-refer yourself onto the interventions. So I'd say that was the one I'm most proud of because I'm probably closest to that.
And diabetes isn't going to stop just the pandemic, is it? So yeah, being able to ensure that happens online must have been really important to your service users, particularly those early stages in their journey with the condition. Does anybody else want to pick up the topic?
The telemedicine pathway we introduced, if that's of use. Yeah, so when COVID hit, we were deemed an essential healthcare provider. So we had to keep ourselves and our services running as best we could, but obviously reduce as much risk as we could as well around patients going into centres. So when the pandemic did hit, the government issued the temporary approval of home use for both stages of early medical abortion in response to COVID. And within weeks of the lockdown, we'd designed and implemented a telemedicine pathway for eligible abortion patients, enabling consultations both by phone and video call, which is quite a transformative thing for us to stand up so swiftly, certainly from the video perspective. But it really did help with patients seeing, you know, the clinician in the flesh, even over a video call. It meant that risk was really significantly reduced. We also stood up the web chat as well, which really assisted a lot of our vulnerable patients, people that didn't have the space to pick up the phone and call to talk about having an abortion, for example, if they were being coerced or if there was a vulnerable situation at home. So introducing the web chat allowed them to talk safely and privately to us and to our clinicians with privacy and without the need to actually be overheard or anything like that. So it's been a really transformative year for us because of COVID, which it's been a huge benefit for our patients as well.
And absolutely like amazing for us to get online and get it online so quickly. There must have been so many hurdles there. I guess that hearing that really sort of highlights the diversity of service users and perhaps how it's implemented can really keep people in a lot of different situations, a lot of different types of risk potential. So absolutely. Yeah, really interesting to hear. Thanks, Steph. Matt, Suzanne, do you want to? Yeah, Matt, are you going to dive in?
I can happy to dive in. I think from my perspective, when the pandemic hit, when was it, last March? There was a real panic within our family network. We had an existing family network, which was based around a Facebook group, which is a peer-to-peer support network, and we brought the family community together through face-to-face events, which were actually very time consuming to put together, and you know, were very resource intensive to put together. But when the pandemic hit, the online peer-to-peer support group grew within that first lockdown by about 20%. We just saw this exponential growth, and the amount of activity in that group just was astronomical. I think there were 1,200 different conversations about COVID and how to care for my child. There's a huge amount of panic as families care stopped coming. I think 70% of families reported that vital care and support coming to their homes had stopped during COVID. The lack of inadequate government advice left many families confused, not quite sure how they should interpret government guidance. So that kind of prompted us really to really change what we were doing and try to demystify the world for these families at that time. So we quickly launched a suite of online information provision, which we hadn't had previously. And I think that's one of the big things that's come out of COVID was our ability to react to what we were seeing and deliver back to the families a new area of support and service that we hadn't done previously. Very quickly. So we ended up publishing, I think, more than 50 online articles and resources, which I think in the end were accessed over sort of 53,000 times via the website. And it was a huge addition to our service offering that we hadn't done before, but that we had to enact very quickly because families really needed it, and they needed it now. You know, we couldn't sit there and plan what our content schedule was going to be, or how we were going to manage this from a governance perspective and what the processes were around it. We just had to crack on and do it. And I think that was one of the things that we've changed is the delivery of that online information off the back of our family network, as well as enhancing that family network as well. Doing a lot around that in terms of online events and really bringing digital to the forefront of what we do.
That theme of kind of cracking on and doing it is definitely something that we've heard so far. And you know, in Australia, the pandemic was all the permission to do that, didn't it? Like your organisation, perhaps, you know, more than anybody else on the panel, is really directly intersect with what's going on in the world right now.
It was really the perfect storm for a bereavement charity. You know, excess deaths, unfortunately, far more people grieving. The circumstances of that bereavement being typically more complex, you know, people not able to say goodbye to loved ones, and then people grieving in isolation following the bereavement. And actually all of those things require people typically to need more support. So a lot of pressure on our capacity, a volunteer network all based locally who are used to going into people's homes to deliver support services. So making that change for all those volunteers, equipping them to deliver remotely, was an enormous challenge, and one that they rose to, which was absolutely amazing. And not just that though, the need to supervise and train all those volunteers remotely as well and look after them during that time. So that was huge and significant change for the organisation and for the operations teams, you can imagine. And then in terms of what we saw going on, was that people were coming to Cruse much earlier in their bereavement journey, perhaps because they were isolated, perhaps because the circumstances of their bereavement were more traumatic. And actually our website traffic was just, you know, increasing and increasing. And the capacity on our, you know, our helpline calls were increasing. So we introduced web chat, which we anticipated was going to have about 500 sessions a month. It has 3,500 sessions a month. So I think that laid to rest any anxiety, and there was a lot within the organisation about whether bereavement support and digital could ever be a good fit. So I think, you know, that that addressed that question. And like you were saying, Matt, I think one of the things that we had to do very quickly was, increase our information provision and, make that much more sort of user focused. I think it gave us this opportunity to do that and do it rapidly in a way that we may have struggled to do otherwise. So yeah, it's across the entire organisation, just absolutely everything had to be, we had to consider how we would do it remotely.
Yeah, everything had to be kind of retooled. A lot of organisations overnight. Some really interesting things, themes emerging already around kind of empowering our service users to help themselves a little bit, making sure that what we've got out there is accessible. I think as well that point around volunteers is really important. A lot of people think, oh, if we're going to deliver services digitally, we need to make like a chat bot or some entirely digital solution, when actually thinking about making those volunteers able to shoulder some of the weight digital is part of the story as well. Maybe one that get enough air. So no, it sounds like everybody has made incredible progress. Probably a coincidence, therefore, that you were invited on a panel to talk about that. But I'm interested to hear, like, why, assuming that the last 10 years for you has not been at the rate of progress that the last year has. I'm just going to assume that. Why has it been possible now? What's, obviously COVID, but like, what are the specific circumstances, changes, factors that you think have been responsible for this acceleration? Because I'm sure we'll be thinking, hang on to those.
There's something around, the proving in the doing. So we had talked before in the past. So I'm a co-lead of a kind of harnessing tech kind of, we call it outcome driver. It's linked to our strategy. And we had kind of gamed, if you like, what being a officeless organisation would look like. But it was very much, future thinking out there, and not something really that was of the moment. And then I think the very fact that people had to, and obviously it begins with the lowest rungs of the ladder, and they are video conferencing. And people suddenly begin to think, well, actually, we can do some of this online, and I think that's where obviously it began. So the immediate transformation has been in our ways of working, kind of improvements in meeting. We had this kind of terrible situation where we've got offices in the 4 nations, and if I'm really honest, I don't think they ever really felt totally integrated with our office in London. They might be there on a meeting in a TV, somewhere, but they weren't really integrated properly, and they've really felt part of the organisation in a way that they never did. Same for people working from home. I think the more difficult bit, and the bit that we're now beginning to move to, is how to make this type of work really kind of work smoothly. So it's everything from moving away from the dreaded emails, I hate emails, to project management tools, working on files together rather than sending attachments, small silly things, but when you're working at home, they can be the difference between making a job doable and kind of undoable. So that's the bit of the transformation that's happening now, but it would have never happened without the pandemic. Recruitment of people outside London. I really struggled to fill a web analyst role, got a brilliant web analyst based in Norwich, who just wouldn't have applied otherwise. So there's all of these things. I think Laura Burns, who was at the Scouts, called it kind of digital transformation by pandemic. And it's almost like we all knew it was possible, but until the majority were kind of forced into this situation, and the benefits have been many. There are downsides, absolutely, but I don't think it could have happened if this, pebble hadn't been dropped into the pond.
Those things add up, don't they? Our kind of culture around, capable of conversing or not generating more email. That those little incremental gains really add up to a lot. Matt, do you want to comment on that?
Yeah, I was just to follow on that, really. I think a lot of the, no doubt, COVID accelerated a lot of these things, and in fact, even with some of the new services that we introduced and some of the enhancements that we introduced for our families, a lot of them were ideas that we'd had for the last couple of years, but we'd spend a lot of time thinking about what funders we needed to attract, what the structures were going to need to be supported, and then COVID happened. and we just had to do it. And I think what happened then was not only did it get accelerated, but it got validated as well at the same time. And from that validation came organizational confidence. So I think that actually this stuff works, and we didn't have to spend 6 months planning and scratching our heads around how it was going to do it. We just had to get on with it. And I think from that, I think that there has been a bit of a change of culture in actually we become possibly less fearful about trying things and trying new things quickly, which actually is thinking about digital and the tenets of agile working is what it's all about, isn't it? It's testing things quickly, putting stuff out there, seeing what works, seeing what doesn't, and adapting accordingly. And I think everyone was forced into that kind of agile way of working where people could test things quickly, and if they worked, it gave them the confidence to build on them. And I think from our perspective, that we've kind of seen that play out because we were forced to play that out, as opposed to having to crank the organisation to this culture that you want to develop. I think that makes sense.
The culture overlooked thing, a lot of the time I think, how do we hang on to this piece of technology or this process, but actually attitude, giving things and being confident that can achieve those an organisation is important. And I guess we'll always have to point back to as a time we did that, and it, which is very powerful. We're getting some questions in the Q&A. Free everybody to add those. There's some already been asked, and if you can, even if you're not asking a question, you can click on Q&A there. You can vote on those questions, and I'll be asking the ones higher up list. So do vote on the ones you want to see asked. Suzanne, did you want to jump in on that?
Yeah, I mean, I think just echoing what Matt and Siad have said, we had at Cruse, there were the direction, the strategy and direction were about supporting more bereaved people, and much of the focus of that was going to be on digital delivery. But we would have done that cautiously and through a range of pilots, which is absolutely right, that we would have rolled out, and then we would have dissected, evaluated, and then communicated more widely to the organisation and looked at how we would, support adoption. What this gave, in our case, was every volunteer had the opportunity and experience of delivering remotely in a way that we would never have we just would never have approached it like this before. And I think that was really, really powerful because, say everyone got the hands-on experience of it. And we were able to collect a huge amount of data about client satisfaction levels and clinical outcomes, a persuasive set of data. And I don't think pilot data would have been as persuasive to people, truthfully.
So recontextualizing what happened is this kind of big clinical, almost all these people able to capture the outcomes for them is really
exactly. So I think that, and I think reflecting what other people have said, that now gives us the confidence to and learning to proceed from there, so yeah.
Away for many people maybe listening in is data captured over the, what can we, what insights can we extract from that data, because we've just been through this vast experiment. We really, at Reason Digital, we're a social enterprise that makes websites, apps, etc. for charities. We found a lot of charities more willing to work with us remotely than we did before, and tools like and calls, whereas unless you can get to our office in London, we're kind of not interested. So we really see that even a step sort of from the front line as well. So yeah, completely echo that, Suzanne. Steph, did you have anything to add to this one?
It's very, very similar to Suzanne's experience, to be honest. We've really, it would be pilot central. It would be literally constantly running these small mini pilots and catching all the data and looking at that. But obviously, healthcare, we had no choice but to just go for it. Obviously, we tested it very robustly, as much as we could in the short time that we had. But I mean, the statistics have spoken for themselves. I think 80% of our treatments now are for telemedicine. for MA, sorry, and about 40% of that MA is purely telemedicine. So the statistics are the data is really determining it. I don't think the things we've done now, such as the web chat, the video conferencing, peer support platforms, would probably have happened at the pace that they have. Web chat, again, very similar to Suzanne, 4,500 chats a month. On not even full hours, because our agents are also very busy on phones as well with 180 person call centre. So it's it's just been a catalyst to throw us out there. But I think the key for us was that we were doing a discovery with yourselves, actually, Matt, at Reason Digital. We did a digital discovery to know what our patients wanted, interviewed them and spoke to our staff and ran some workshops as well. And that really... And that was all around the same sort of time that the pandemic was kicking off. So I think that was so valuable at the time to get that research and have that hard data from the people who use our service to tell us what they want digitally to improve the service. And that added extra weight to pushing these other things over the line and really getting that firm strategy in place to deliver the roadmap.
Yeah. So that's really emerged as a theme, is kind of researching, deriving insights from data, talking to users. Matt, you spoke about that as well, in terms of seeing what your families wanted in those Facebook groups and observing that. So yeah, creative approach to that too. Correct me if I'm wrong, Steph, but I think was it that you said that something like 6% of service users said that they would probably keep going with the digital service even after COVID, that it was some majority of your service users, I think, said that they actually potentially prefer the way that you're now doing it. Oh, hang on, I've lost Steph. I think you're back, Steph, but just muted. Your connection might just drop there.
Can you hear me?
I can, yes.
Yeah, sorry. Can you repeat the question? Apologies.
Yeah, just read that around 66% of your service users say they actually prefer the digital service and might continue to use it even when COVID's not around anymore.
Correct. Yes, absolutely. It's a really strong case for keeping the telemedicine pathway, just because people prefer to have that remote option, and having that telemed or video cons appointment is their preference. They don't want to come to a centre if they don't need to.
Should make that it's like, oh God, mess, deal with this, and you've actually managed to go around and create something better.
Yes, it was better. Absolutely.
Yeah. Great. I'm going to switch over to questions from the audience now. So our most popular question, we clearly got one thing on the brain as an audience, and that is fundraising. So we've got a most upvoted question here from Keith Godwin. Thanks. Does anybody have any particularly exciting fundraising initiatives that were implemented during the pandemic? Do you have a think? I saw one, funnily enough, Laura Burns spearheaded at the Scouts. So I mentioned Laura before, that this kind of scouting around the world, this kind of platform which we actually helped them implement there at Reason, and they that was very successful for them. I think raising hundreds and hundreds of thousands of pounds, and it was something that I know that they developed in a matter of days. So it is possible. Anybody else seen any examples of fundraising success, either from their organisations or others that they're a fan of? Said?
It's slightly different in that we already were running the event for a few years, but obviously all with the close down of some of the kind of let's call them face-to-face fundraising events, that many charities are kind of pivoted to. They're called, mass participation events, essentially self-service events. And I think one of the really interesting things for us has been, that sweet spot between mission and money. So the Million Step Challenge, which we did last year, and we raised over £1 million, where you do 1 million steps over 3 months. And if you imagine the value of that, because in that first lockdown, how valuable that was to people to be able to get through. But I'm actually doing it this year, which is not, I don't tend to do kind of fundraising events, so it's a bit of a first for me. And the power of the community in kind of keeping people kind of going, whether or not they're got diabetes and trying to put their type 2 diabetes into remission, whether they're doing it to fundraise or just to kind of keep fit and keep active during this time, has been absolutely astounding. And I've been blown away by, the Facebook group that sits behind it. and it's all self-service. So it's all been, we've built a digital platform that enables you to get badges when you get to 100,000, 200, and at different steps. But essentially, it's about people doing it for themselves and encouraging each other. And it's been an incredibly powerful, both from a fundraising perspective, but also, for me, I think from a personal perspective, actually. I think we've lost Matt. So, Steph, you've been last in all of this. Shall we go with you? I don't know if...
add much to the charity question, actually, because we are NHS funded, so we're commissioned in that sense. That's more for business, so I can't say too much for the global side, I'm afraid.
Suzanne, have you done on the fundraising side?
Really, quite like Steph, much of our fundraising effort during this time has actually been to statutory funders and organisations, all of which has been really successful. And like you were saying, much of our fundraising is community fundraising. So in the same way that you have been, it's been pivoting that to sort of the participation events and so forth.
Matt, I know you had a fairly successful kind of COVID emergency appeal. I think you launched in early March. You right at the start. How did that go?
That's right. Well, I mean, at WellChild, we sort of get very little statutory funding. We're almost entirely voluntary funded, and we rely heavily on events and corporate partnerships, which often revolve around events. So when COVID happened, I think we were stood to lose a 60% loss of our forecasted income when COVID hit, just through lost events and what have you. So I think we quickly realised we had to act fast. So we launched a COVID-19 resilience fund, which we used as a bit of a rallying cry to all our supporters. And I think one of the things that we did learn was the value of the partnerships that we had built up, and actually the funders who we've worked with for a long time, the number of them who came out to support us during that time, as well as bringing together sort of individuals fundraising and trying to ramp that up a little bit more. We set up a crowdfunding page to fundraise for our resilience fund, and I think we raised around £60,000 for our resilience fund just through various activities. But I think from a fundraising generally perspective, I think one of the things that we've seen is that while one door closed, others did open. And I think on the digital side, we were very fortunate to consolidate some of the learning that we'd had through the service delivery. We got accepted onto, we're very fortunate to get accepted on programs like the Catalyst program. We've just kicked off Conflict Relief Tech for Good program. And I think what those have done, those have been pretty exciting for us, because for our team, whilst we've learned a lot through execution in the early stages of the pandemic, what those being involved in those programs have done is consolidated some of that learning, particularly for the team members for whom digital is a relatively, digital service delivery is a relatively new thing. So they're now beginning to learn the principles about Agile, as well as getting fundraising funding as well to cover it. And I think our fundraising team certainly have got more excited about these sorts of areas, and the possibility of digital as another thing that they can sell to corporates. So that's been another example of where some doors have opened. Some new partnerships emerged. We had an amazing partnership with the Jockey Club, which was on account of the fact that their main sponsor had pulled out because of COVID, so they wanted to give it to a charity. So we were the charity partner of the Cheltenham Festival, which just came out of the sky for us. But it was just a great opportunity. So I think while some doors closed, I think it was just being wise to what others were opening at the time. So I think that's some of the experiences that we'd had.
Great, thanks, Matt. I've got a specific question. In fact, I've got a couple, but I'm going to sort of put them together into one, which is around the transition to volunteers going digital. How did that actually happen? How did you motivate them?
At Cruse, there was a massive investment in internal comms. It was the first thing that had to happen, and communicating to the volunteer network is a huge challenge with so many of them. So, you know, a lot of that was managed through internal comms. People were given the choice, you know, obviously they're volunteers and they are in control of what they do. I think we facilitated a lot of conversation between volunteers. Our clinical director held a lot of webinars. We brought in speakers. So we tried to create virtual community for them to, you know, feel part of and, you know, discuss their experiences of it. Yeah, I mean, it's a tricky one, and different volunteers have felt differently about it, you know, is the truth. We thought that we would see more uptake of Zoom, but actually we found that a lot of volunteers were preferring to deliver telephone support, and we've supported them to do that, you know. So I think we've given people necessarily the choices to do what they're comfortable with. At the same time as trying to, you know, facilitate more virtual community and support for the volunteers. You know, their job has become much more intense. So they've required more support. It's been a very difficult time for them, you know, so I think we've acknowledged and respected that. And I think, I can't remember who earlier was saying about I think like many charities, we've had the sort of national versus local axis at play. You know, that's most people here won't be a stranger to that. And I think what happened during the pandemic and the shift to remote delivery was obviously it totally eroded that, that distinction. And I think we're still working out exactly how to manage that, but in our sort of efforts to become one Cruse, I think that has really helped that, you know. So I think we internally in central office feel much closer to the volunteers now. So I think it's removed some of those barriers generally.
Great, thanks, Suzanne. So multifaceted, you have to sort of that problem on a different level.
Exactly.
For every volunteer. So
yeah.
Great. We've just got time for one last question. So, which I'm going to sort of adapt Jamie Walker's question here, which is just to ask each of you, perhaps starting with you, Steph, what your one takeaway has been. I'm sure there's been dozens of takeaways. But, you know, there's one thing that you're really taking away from the last year that maybe you'd love, you know, other people in your shoes to kind of know. What would be that one thing?
I think that's the digital discovery for us, literally asking people what they want and what could be better about their digital experience. Obviously, with the services we offer, they're very sensitive, they're very emotional. We've got lots of different needs from different people, different age groups expect different types of technology to be available. So doing the digital discovery helped us understand the majority breakdown of the different types of available technology people would want. So we've not had anything for so long, having web chat in place, having video conferencing in place, having a peer support platform for them to speak to one another anonymously, to know they're not alone. We asked, they've told us, and now we just need to do it. It's not as challenging to approach, you know, business cases and budgets and getting it on the strategy if you've got the data from the patients or from the service users to say, please give us this. If you've got that behind you, that will really accelerate the focus and the determination to deliver it. And of course, yes, the pandemic has accelerated all of those things, but I think the takeaway is the digital discovery, and then plug the findings of that digital discovery into a really clear and easy to interpret digital strategy. Rather than it be a big, 10-page document with lots of text in it. You want that document to be really transferable and layman's terms for everything, because digital can get quite complex when you start throwing things like AI around. But getting it to a position where you're highlighting the benefits of why you're doing this, showing that you're going to be collecting data to continue to evolve. So yeah, that for me, it's digital discovery. And also a digital strategy that's firmly embedded, so you know what your roadmap is and you know the direction of travel.
Great, thanks, Steph. So yeah, my clock is flashing. We've got just 1 or 2 minutes left, so I'll move on to you. If you've got a quick takeaway from the last year? Maybe you could go back in time and tell yourself one thing before this all. What would be Siad?
So my reflection is, especially with the bigger charities, we got there in the end, but we're not good at moving quickly. We're by nature risk averse, and that's partly a result of the kind of funding model, which is not good at funding test and learn, failing fast, all of the things we talk about, minimum viable products. There are opportunities for smaller charities, which they in some cases fill, but actually, if I look in my local area, especially at the beginning of the pandemic, the most visible response was from Mutual Aid, my local football club, setting up stuff, AFC Wimbledon, Don's Local Action. They were the people collecting food outside the supermarkets, not the charities. So there's something for our sector here, which is about appetite for risk and need to move quickly, and we need to learn from it.
Great, thanks, Siad. Yeah, often people that are already built that kind of digital audience and that capability were the ones rushing to the front at the start, weren't they? Suzanne?
I mean, I think apart from the reflection that everything can change for better or worse, and, you know, whilst that brings uncertainty, it also brings a sense of freedom with it. I think the notion that behaviours and attitudes change, I think, you know, within Cruse there was quite a fixed mindset about what our clients and service users want and expect. So, you know, going back to Steph's point about, well, actually, let's interrogate that a bit more. You know, are we certain, or is that changing, and is it in flux actually quite a lot of the time? And I think that's what the pandemic has really revealed to us. You know, so some of the anxieties we had about whether people would want to use a digital service and all these kind of things have actually, you know, we've really gathered the evidence now to indicate that those worries weren't perhaps as, you know, as pressing as we imagined they were.
Thanks, Suzanne. Matt?
Flows, I think, from both Siad and Suzanne and Steph's actually, and that's around adaptability to change, people's adaptability to change, and to trust people's adaptability to change. And I think pre-pandemic we'd be quite fearful, both in terms of our own internal IT systems and digital, moving to the cloud, moving to remote ways of working. We would have been fearful of that. Home working was something that wasn't particularly, it's not something that we did. But actually, when you're forced into a situation, you realize that people adapt very quickly to these things. So I think it's about committing to those decisions and actually trusting in the fact that actually people do adapt to these new ways of working probably more quickly than you think they will do.
Yeah, absolutely. I think a lot of people learned that. Well, that is all that we've got time for. So thanks so much to all of you for giving you time to be honest. And yeah, you know, maybe it's worth taking a moment now we're getting towards this new normal, you know, it's feeling like this, whatever it is, to reflect, you know, those journeys that we've all made as charities, and that kind of abject panic that I remember at the start of this about, you know, how the hell are we going to kind of deal with this, with the cultures that we got, the slowness in the sector, the lack of investment, and, you know, every panel, and I'm sure, you know, many of us in the audience have found a way to not just kind of survive, but thrive through that period. So thanks again, everybody. I am going to pass the mic back over to our host. Are you with us?
That was a really insightful panel, and thank you to all our esteemed panelists as well.